Hey everyone, this is Dr. Jamie Nodler. I'm one of the fertility docs at CCRM in Houston, and I'm pleased to be joined here today by my wife. This is Dr. Abby Nodler. She is a psychiatrist, and I think someone that we could all use right now in these really difficult times. And so we've done some videos before about taking care of our bodies, but one thing I think would be really important to talk about today is mindset. So I'm going to start just by asking Dr. Nodler, what does mindset mean to you?
Mindset is, I think a lot of people think of it, it sounds kind of simple, but it actually is something that sort of affects our daily life, every second of every day. And in that, the broad idea of a mindset is basically a group of thoughts or feelings that you carry with you. And they can change based on the situation, but typically day to day they have a general theme that they sort of that they adhere to.
Okay, and so when we're talking about mindset right now, some of the things, some of the particular stressors we've got are, our patients, they want to be undergoing fertility treatment and we can't put a lot of them through the cycles. How can we maybe adjust our mindset? Should we adjust our mindset? What do we do about mindset in times where we have these big stressors?
I think the first thing to do is and maybe do a little research on your own as to like what mindset is, so you can get some different exposure to different definitions and different explanations, because it's a pretty broad topic, is to pause and think about what your mindset is. What's your mindset around fertility? What's your mindset around COVID-19? What's your mindset around your finances? And take a minute, and the first step is to identify what that mindset is. And it might be important too, if you're in a relationship, to maybe jot down mindsets that you have, like this is never going to be over, or we're going to get back to life as normal soon. These are two very different mindsets that would then govern my thoughts, feelings, maybe some anxiety or symptoms of sadness and depression. And the same things apply to fertility. So when it comes to your fertility or building your family, you're going to have a particular mindset, and that's of utmost priority to identify what that mindset is first and foremost. And then maybe take some time and identify what your partner's mindset is around that specific thing in this current climate. And then when you go from there, you can make some progress moving forward.
So what I take from that, and it's really helpful, is before you try to trudge into how do I fix my mindset, first take a step back and say, what is my mindset? Maybe kind of assess. And so what do you think about things maybe like journaling or, right. You mentioned making lists in terms of what are some of the best ways to take that time and determine our mindset. Maybe another thought would be maybe isolating yourself, maybe stepping away from your family or from your partner for a little bit, go into another room or something like that. How would you tell someone to develop their and kind of take stock of their current mindset?
Right, and I think that's an important thing. I think it's pausing in whatever way you can pause. If you live in an apartment building and stepping outside isn't the safest thing to do right now, maybe you could be in a room by yourself, or you could listen to some of your favorite kinds of music. You could take a warm bath. You could go on a walk if that's something that's available to you, or a bike ride, and get into a space where you can be sort of more aware of your thoughts instead of all of the news or social media sort of coming at you and sort of interfering with what your mindset is, but to be calm and to take pause and be quiet for a moment to think about what that mindset is, what thoughts pop up, what sort of, and when we think of like mental health, you have your thoughts, and that's what we think mindset is. Mindset is a set of thoughts, and again, they change based on the topic or the situation that you're in. But you might start to see a general theme in those different kinds of situations, which might help you figure out what your mindset is.
And one that I've noticed and practiced on is what about turning our phone off?
Right.
So, obviously we have to be plugged into work, but that's something that I've even tried to do is when we're on our off hours is just try to step away from that phone, step away from the news for a little bit and let yourself have a little reset.
Right.
And so, thanks so much for listening to us. This is hopefully the one of many videos we're going to share with you guys. We're planning on doing some more videos about maybe some of these individual stressors like marital stressors, financial stressors, hey, I can't go through fertility treatment right now stressors. And so we'll be back for more, and we'll bring the other Dr. Nodler back for more as well. And just so you all know, at our CCRM clinics right now, we are still seeing patients, new patients, and revisits. We're trying to do this through telehealth as much as possible to keep you safe, to keep our staff safe. But you can still call our scheduling number that you can find on our website, CCRM Fertility, and we're happy to take care of you. All right, that's it for now.